Good afternoon and welcome to Frankly Speaking About Cancers, Why Can't I Stay Positive? A presentation part of the Cancer Support Community Central Ohio's Lunch and Learn. I am Darlene, the program manager here, and I'll be the one presenting this information from the Frankly Speaking About Cancer. So let me go ahead and do a screen share here and get this program up and running. Throughout the session, you are more than welcome to ask questions as we go through. You do not have to wait to the end because of, if you're like me, I tend to forget what question I had, and
all I'm getting here is
it's no longer relevant. So we will be talking about why can't I stay positive, and there's three different areas that we will be discussing today on this presentation. We'll be talking about grief, depression, and resilience. So there we go. So everybody should be familiar with Cancer Support Community's mission of why we do what we do. And this next one is just saying that, Frankly Speaking About Cancer was developed by the Cancer Support Community, and the only financial relationship I have is being an employee of the local affiliate. So diving into our presentation, we're going to be talking, as I mentioned, about depression and grief and resilient, and then we'll be ending the topic today on the resources that are available through Cancer Support Community. So our first part of the presentation today is setting the stage. There are some universal challenges of living with cancer that has been identified, and as you can read through the slides here, everybody's cancer, and I'm sure you've heard this before, everybody's cancer is unique, and your journey is unique to you. But these feelings and these, the financial burden and the loss of hope, the loss of control, unwanted aloneness, and living with uncertainty are usually experienced to some degree by everybody. That's why they have found that those are the universal challenges of living with cancer. And this next slide shows the top 10 concerns. And this data came from the 2020 Cancer Experience Registry. You may have heard us talk about the registry before, but this is really part of Cancer Support Community's Research and Training Institute. And we have the registry is a survey that we gather information from. So it's really a forum for people impacted by cancer to share their voices about issues that matter to them, and to connect with each other, that part of that community, and then to ensure that their experiences are communicated with a broader cancer community. Really, the goal is making a difference on how people move through their cancer journey. And so as you can see, these top 10, that the eating and nutrition is tied with the concern of recurring, the cancer coming back, very closely followed by worrying about the future and what lies ahead. So these are across the board, and as you can see at the very bottom of the slide, that the sample size range from 2071 to 2089. So it's not a small pool of people that they're pulling this information from. It's quite large, and again, it's across the country that this Cancer Experience Registry people participate in. And so these statistics, again, come from the Cancer Support Community's 2020 Cancer Experience Registry report. They have a general cancer registry, and then they have a caregiver cancer experience registry. And so these numbers here come from the registry for patients and survivors. And even though we, Cancer Support Community Central Ohio, identify all of our participants with the cancer diagnosis as a survivor at the second that they were diagnosed, other places use patients. But these are the people who are living with cancer. And so as you can see, almost 50% were at risk for clinically significant levels of anxiety. And a large number were also identified for significant levels of depression. Going back to it's pretty common. And again, the same report, the 2020 Cancer Experience Registry, shows for caregivers, the numbers are very similar to the survivors. Almost 50% identifying with anxiety. I'm sorry, 49% have anxiety worse than the national average. And then as you can see, fatigue, and then the caregivers' health themselves were somewhat worse or much more worse after they began their caregiver role. So important things to be aware that a lot of caregivers are experiencing these things. So as we're looking at living with uncertainty, 53% of the respondents indicated that they were worried about the future and what lies ahead. If you remember from just a couple of slides ago, that was the third one from the top. And as you can see, some of these feelings that the people have identified with these living of uncertainty is like, we just don't know. We don't know about the treatment. We don't know about, we don't have crystal balls. We don't know what's going to happen, and having to put those plans that we've had on hold because of we're not too sure of where we're going to be in 3 weeks, 3 months, 3 years, and so that uncertainty is real. And then as we're looking at, what is some of the things that really deplete our resources, and the first 3 on this slide show the uns. We have unmanaged, untreated, and unrecognized, and then limited. So that distress, the depression, and the grief, and then the social supports are all things that just deplete our resources. So looking at distress as one of those, distress is a mix of anxiety and depressive symptoms, and it may cause sleeplessness, lack of appetite, trouble concentrating, and difficulty carrying on regular activities. Although, stress is normal, about a third of cancer patients experience significant distress. Only about 5% of those with cancer actually obtain psychological help. And while distress doesn't affect the cancer itself, it does affect how survivors cope with their cancer and their ability to follow treatment recommendations. And there's some predictable stress points: diagnosis, treatment decision-making, scans or scan anxiety. That's where you have anxiety about scans, and then cancer progression. And so as you can see on the slide here, some of those things with the distress and the thing about it's not something that you just should have to live with. And please don't ignore that if you're experiencing distress. So this next slide, and I do apologize in the very beginning, I didn't suggest and recommend that people have a paper and a pen, but if you have something to write down, this next slide is from our cancer support source. It's our depression distress screening tool that we use. Usually we do it online now, but as you're reading through these different statements, think about which of these are you most concerned about? Moderately or seriously or very seriously? So you can see the scale across the top here is today, how concerned are you about communicating with your doctor? And if you're like, not at all, that would be a 1, or I'm slightly concerned about communicating with my doctor. But we're really going to focus today on the moderate, seriously, and very seriously. So we're going to take about 5 minutes to give everybody a chance to read through these and just jot down those ones that you would identify as being concerned about either moderately, seriously, or very seriously. We'll just take another minute to finish up. So as you're looking through this list of 16 questions, which one of those, and if you're comfortable sharing, you do not necessarily have to, so please don't feel any pressure. But if you're comfortable sharing, which one of those were that you felt were concerning to you, either moderately, seriously, or very seriously? Does anybody like to share?
Yeah, I will.
Okay.
Let's see. Gotta figure out where we are. Exercising and being physically active, and then feeling too tired to do the things you need or want to do. And that was seriously.
Thank you, Marlene.
Yeah, a bunch of moderately too, but those are the serious.
Well, thank you for sharing that. Yes, being able to be physically active, being able to do the things that we need to do. Yes.
I think health insurance is a moderate concern for me. I had quite a few moderate, but not any serious or very serious.
Yes, and unfortunately, with health insurance and the you never really knowing what the changes that are coming down to the pike when we have open enrollment coming up here in another next month, and how that could possibly affect our coverage and thank goodness we have some things in protection with not being able to be denied coverage, but yes, insurance. I remember seeing several of my dad's hospital bills, and they were pretty horrendous, and all I could say was thank goodness for insurance. But yes, I could definitely see that being a main concern.
I'm in a transition right now. You know, I just went on long-term disability, so my health insurance is kind of in limbo, which is a
Oh.
big concern.
Yeah.
Yes. Yeah, hopefully you have a somebody that you're working with, like an insurance broker or somebody who is knowledgeable in that can help you walk through the steps on that.
Yeah, it's just the waiting to get it processed is aggravating.
Yes, it's never a quick process. Yeah, and as you said, you're living in that limbo, living in that
Right.
uncertainty.
And I'm, you know, in active treatment, so it's like I can't just not go to my appointments.
Yes.
So I've
Yeah.
had a number of times in the last couple of weeks where they said, well, you don't have insurance coverage. I'm like, yes, I do. It's Cobra.
Yeah.
It's interesting with communicating with your doctor because it's doctors. You have so many doctors and you have various levels of communication with each doctor.
Yeah.
That's
Mhm.
an excellent point. Yes. Yeah.
That's a hard question to answer. If you say you're oncologist, you feel good. You know, maybe if you say your primary care doctor, maybe not so good.
Yeah, that's an excellent point. So I guess that as you're looking at this, it's just the ones that concern you the most with, you know, it's like, well, if they're not talking to me, if they're not listening to me or not giving
Yeah.
me any time, then that would be a concern. But yeah, finding out which one of those you want to reference as you're doing this scale, that's an important part. Thanks for bringing that up. But
Yeah, the communicating with the doctor, the one thing that I've run into is where I have the medical oncologist and the orthopedic oncologist don't agree with each other. And I'm like, pick one. And it's like, okay, are my bones gonna just like break all of a sudden or what? And so yeah, that's what we just kind of do have to pick which one you want to listen to.
Yeah, that's a definitely an interesting point when you have multiple people on your medical team in different specialties and them not agreeing. Yeah, you're absolutely right, Cheryl. It's like, okay, which one in my condition, in my health, and in my journey, and what I'm facing takes top priority. And kind of go with that one. And then tell them that they got to go back to learning how to get along just like we did in kindergarten. That one's a little harder conversation to have.
Yeah.
Yeah, I have found with my oncologist too that I was having communication problems with the sleep doctor and the sleep doctor's nurse. So I mentioned that to her, and it was like 45 minutes later, I end up getting a message from the nurse practitioner. So it's kind of interesting. You can use that sometimes to your advantage. If you think that that's affecting your health with respect to the cancer. And well, I don't know if she'd get involved with other things, but she was certainly interested in it.
Mhm.
That brings up an excellent point, but yes, because we definitely want to take these things that we're moderately seriously or very seriously, and we do want to tell the healthcare team about those concerns. And if you have a nurse navigator, they are fabulous because they can do exactly what happened with Arlene, where she shared with the doctor, but it was a nurse navigator doing the follow-up. Let somebody know that there's issues and that there's concerns, and then you know, they'll be able to pull the team together. But definitely share your concerns with that team that you're working with, and the nurse navigators have a wealth of support and resources, not research, but resources that they can definitely make available to you. And of course, they're on your medical team, so there's no additional charge, or their services are for free. So, if you have a nurse navigator on your team, they are an awesome resource for you.
Well, to James, though, that when you have checkups, they were asking questions like, is there anything else that's bothering you, emotionally, that type of thing. And well, this certainly was bothering me because I couldn't sleep. And so then they followed up on it. So they were kind of asking the leading questions.
Good.
To get you to respond to that.
And if they don't, then please take the initiative to bring up the question. So if you don't have your medical team, trying to find out what additionally is going on, please take that initiative upon yourself to say, hey, I really need to talk to you about this today.
I think it really helps because you see them every 6 months, and I'm not sure that there's any other doctor. Well, my primary care doctor I see 6 months, but other doctors usually don't see that often.
Yeah, my technicians were great, but the doctors, they were just, I don't know, everything was by rote. And with the kind of cancer I had, they said, oh, we've come up with this, cocktail of treatment that is just, we've had miraculous results with. So for me, everything was cookie cutter. There was not a single thing that was tailored to me. And when my second, and the technicians, like my radiologist technicians, were incredible. And I have said a zillion times, in my opinion, my radiologist belongs in jail. I mean, because he was just so unconcerned. I mean, when I came off of, I would have every Wednesday, I would have the oncologist, whatever they were doing in the office. And then, excuse me, there was twice that home healthcare came out and hooked me up to a 96-hour chemo drip. And so it's just 4 days of chemo. And the first one, I thought, it was kind of karmic. It was kind of, slapped back. Because the first time I said, people are such wimps. So I'm a little tired. So what? So I'm a little foggy brain. So what? Big deal. I was still coping. I was still doing whatever. But then after the second one, it really kicked my butt. And they came out Sunday night to unhook me. And I wake up Monday and I have a temperature of 104. I feel like hell. I still drove myself to the hospital for my radiation treatment. And I told the radiation doctor that I asked to see him because I usually rarely ever saw him. And he just said, oh, you're coming at 5FU. That's the worst chemo there is. You're right about where you ought to be. And I'm thinking at 104, at 101, they tell you to get to the hospital. And I'm at the hospital and he's just sending me home. No, I live by myself. And the texts were just kind of what? Same day, the second day, He just said, well, you're probably just a little dehydrated. We'll give you a drip. Well, they hooked me up, but the drip didn't work. I was there for hours and it didn't move. And I kept trying to tell people that's not moving until finally somebody came in and just stuck their hand in the room I was in and turned the light off. And I had to yell, hey, wait a minute, I'm in here because they totally forgot me.
Oh,
and
I would think that in situation, that's an extreme situation, Teresa, and I'm so sorry that you went through that. But when you're getting ignored like that, always ask to see if there's a social worker or nurse navigator and say, I really need to speak to somebody. Talking to the same people or getting that feeling of not being heard, just keep saying, I need to talk to somebody, bring me the nurse navigator, bring the social worker into the office or into my room, because you have that right to, talk to people and getting other people involved. The social workers in the hospital, they might not be oncology social workers, but if you can't get a hold of a nurse navigator, definitely utilize the other staff that are there in the hospital when you encounter situations like that. So I'm sorry you went through that extreme situation, but that's a good message to let other people know that if you're not being heard, just say, I need to talk to somebody. And they need to, they'll bring hopefully somebody else in, and you'll be able to share your concerns in the situation, and then somebody can advocate for you within the hospital realm of she's not being heard and this isn't being happening, and they can get things going.
Yeah, I
the
never
yeah,
understood what
problem is she has 104-degree fever and she doesn't have the energy to do all that.
Well, that's
part
why
of the
you say,
issue.
I need to talk to a nurse navigator, I need to talk to a social worker, and then you get them to be working on your behalf. So you just lie in the
okay.
bed and feel better, and they're the ones who are doing the advocating and getting the communication started. So yes, utilizing the hospital staff when you're in the hospital, or even on the phone at home, is a very important thing when you don't have that energy and not feeling well enough to do it yourself.
Okay.
I didn't really understand, what was appropriate, what I could ask for, what I didn't. And I totally did not utilize the nurse navigator the way I should have and could have. I didn't really even know that she could help me. I just thought she was somebody who, if you desperately needed to talk to somebody, you could spend like 5 minutes, but she had a lot of other patients. And I thought my nurse navigator was great, but I didn't communicate to her really what I needed so that she could help me.
Sure.
And I think so many of us are probably in the thing now where if only I knew then what I know now. I hope I never need it in the future.
Yeah.
I almost want to, anybody I know now that I tell me that, oh man, they got diagnosed, I give them an earful. Okay, these, you have a right to ask this and this and that and that. And they go, really? Yeah, I didn't know either, and I didn't realize I didn't utilize the cancer support community the way I should have either. You guys are such a wealth of everything, and I just didn't want to be a bother.
Well, no one is ever a bother reaching out for those resources. So I'm glad that you're sharing your story, Teresa, and you're being there for the newly diagnosed. But those newly diagnosed also, and people definitely far in their journey, really need to be aware that when people are talking about, being really positive, sometimes positive thinking can be a burden. There's some, people out there who are just saying, oh, negative thinking can bring you down. Negative thinking can affect you. Negative thinking can, acerbate your feelings and your emotions.
Now it shows mute on there.
I'm sorry, Richard.
Oh, nothing. I'm sorry.
And so just, as you're reading through this quote from Dr. Jimmy Holland, that there really is no evidence that high level of optimism prior to treatment enhanced survival in patients with non-small cell lung carcinoma, and encouraging patients to be positive only may add to the burden of having cancer while providing little benefit, at least in patients with non-small cell lung carcinoma. And that was from a journal by Dr. Wiley. We are always talking about the message of hope, and we'll get into hope in a little bit. But when people say you just have to smile and you just have to be positive, there's some benefits for that, but there's also some actual burden being brought on by that. So I don't know if anybody has ever encountered this tyranny of positive thinking, that all you have to do is just smile and get through your journey. I mean, cancer is a difficult and frightening experience. That's reality. Insisting that you put on a happy face when you had just gone through chemo and you're knocked flat on your back and so sick that you can barely get out of bed, it's hard to put on a happy face when you're experiencing that. I remember my dad being so ill and so frail that, getting out of bed just to use the facilities was very difficult for him. And then that unnecessary feelings of guilt because if you can't put on that happy face. And we're human. And we're going to have a wide range of emotions, and not every day is going to be all sunshines and kittens and puppies. It's going to be rough, and it's going to be, a battle sometimes as you're going through your journey, as you're going through your medical treatments, as you're recovering from surgery. And so for people who just say, oh, just smile and get through it, that's just unrealistic. And that it's just not it's just not helpful. And so being able to hear that it's okay to have bad days. It's okay to be part of the cloudy part of your journey. And this slide, I don't know if you can see underneath the number 4 box, but this is actually information taken from The Human Side of Cancer, Living with Hope, Coping and Uncertainty by Dr. Jimmy Holland, or Dr. Jimmy Holland. And so we just, being aware of the fact that sometimes it's okay to just say, this is rough and this is hard. And that's just part of your story and part of your journey. And people need to know that. Excuse me. So in your experience with cancer, have you ever felt a pressure to think happy or put a smile on your face or to find a silver lining in all of this? If anybody is comfortable in sharing, please do so.
Oh, yeah. A lot of times people say, oh, you look great. And I only once said, looks are deceiving.
Yeah.
Yeah, absolutely. And I don't know if
I think so.
anybody's ever encountered somebody who didn't know what to say. So they'll
Yeah.
say something that you're like, what?
Yeah, that's not helpful.
Yeah. And it's just like, they want to be there, they want to be supportive, but what they're saying isn't.
Yeah. And it's just because they don't know. They don't have any experience with cancer or anyone that they know that has had cancer. So
Yes.
I
Yes.
try to give them the benefit of the doubt.
And sometimes it's weird. It's almost like if they associate with you, they're afraid it's contagious and they don't want to go through it.
Mm. I think
Yeah.
it's more, they just don't know what to say or do.
Yeah, I think sometimes, like, I had breast cancer 26 years ago. My son was, 20 years old or something. He was young. He had no idea. Hadn't faced that before. So you have to kind of look at that too.
Yes.
And I think they're afraid for you.
Yeah.
Oh, yeah.
Oh,
They don't
yeah.
know what to expect either. And
Yeah.
we didn't have, back then, didn't have the cancer support community and all these meetings and things.
Yeah.
Was it around then, Darlene? 26 years ago?
Not the cancer support community, there might have been a wellness community, but cancer
Mhm.
support community wasn't around back then.
Okay.
But I think you're absolutely right, Heidi, in that sometimes people make those comments because they just don't know. And they're trying, and as you said, giving them grace and the benefit of the doubt that they're trying to be helpful. It's not. And I loved your comment about looks are deceiving because of, some
Yeah.
days we just don't feel up to it. And that's perfectly okay.
And I
Yeah.
try to put on that mask, like I have my ritual every day. I do my makeup because it makes me look better, but maybe not feel better inside, if I've got some pain or something. But like my best friend that I've known for 60 years, I know she struggles with my illness and what to say or do, but just being together and doing our usual stuff, shopping or, going to a concert, that's all I need, from her. And I know that's all she's capable of.
Yeah.
So,
Sometimes it's just sitting beside you.
yeah.
You don't even have to say anything, just being physically present speaks so much more volumes than somebody trying to give, words of comfort.
Yeah.
And as you said, it's what she can do. And you recognizing your friend that, she's being there at what she can provide.
Yeah.
And that's pretty wonderful.
Yep.
So we're going to move into talking about depression and cancer. And so when we're looking at, what is depression, you'll see that there's about 4 different parts of what we're going to be covering. There's a actual diagnostic criteria about depression that we're not going to get into, but there's, situational depression where something's going on and you are experiencing those feelings of depression, and then you're able to work through and, move on. And then there's clinical depression where it's more in the need of maybe some pharmaceutical assistance or counseling to help you get through those. But just being aware that, there's, as you're reading through these 4 statements about what is depression, just being aware that it is also very common for everybody to feel sadness, and it doesn't necessarily move over into depression. And so there's and again, being aware that there's those times where something might have happened and you're depressed for that period of time as that situation's working out. But then the clinically, the significant clinical depression is a whole nother category. So the first thing we're going to talk about with depression is we're going to look about our mood-related symptoms. And so as we're thinking about these feelings, you may have experienced these at one time or another. These are very common moods, but we're really more concerned about if these feelings last for a significant period of time, if these are feeling of that hopelessness or irritability lingers and it is there for several weeks, then it's something to definitely be aware of, that this might be something that you need to follow up on or talk to somebody about. The physical symptoms, as you're looking through these, the insomnia is the not being able to fall asleep and stay asleep. And the hypersomnia is feeling very sleepy most of the time. It's just kind of the lethargic sleepiness throughout the whole day, where that insomnia is not being able to fall asleep and then stay asleep. And if you're experiencing any sexual problems, that may be more like a lower sexual desire, where that the feelings are just not there at this point in time. And our behavior symptoms, as you're going through, usually when you're doing a depression screening, these are questions that are usually on that screening, such as that loss of interest in activities that you used to enjoy. And if you're really withdrawing from your family and friends, and that loss of motivation to do daily activities. And again, sometimes we experience these, but then they're gone within a short period of time. We really want to be concerned if this is going on for weeks at a time and not being alleviated. And then the cognitive symptoms, as you're going through what depression is like. If you are experiencing thoughts that life is not worth living, or even having thoughts of hurting yourself or suicide, please, please, please take time to talk to somebody about that, a trusted medical person on your team, a nurse, a social worker specifically. If you ever feeling those things, call Angie or myself, because those are very real feelings, and we want to help you process through those. You don't have to be burdened with those kind of feelings. We can definitely help with that. So if you ever, if it moves into that serious state, please speak to somebody. So what do we know about depression? As my screen advances here, we do know that it's common. As you're reading through these statistics on here, approximately 1/3 of cancer patients report a mood disorder at some point after diagnosis, with the first year after diagnosis really being the greatest risk. And in between 10 to 20% of cancer patients continue to report depression and anxiety after the initial stress of the diagnosis or recurrence. And more than half of cancer patients and survivors report fatigue as an ongoing issue. And a large number of survivors continue to also struggle with pain and isolation. And those are from some research that was done in 2014. And so, you know, if you're feeling that you are experiencing these things, please talk to a licensed mental health professional or a medical, one of your medical professionals on your care team to discuss this, and they could, you know, go in more in depth with you on, you know, a screening or follow through on some of these feelings of helping you get, you know, finding you the help that you could need. But, you know, definitely, please, this is not a topic that staying quiet on is okay. And I know I'm coming from the social work standpoint, but you know, that's my social work bandwagon.
Darlene, I think a lot of times nobody really tells you that how long this recovery is going to take. You figure, well, if I'm going to be off work for 4 to 6 weeks, that means I go back and everything's fine. And sometimes it's going to be a year before you're really feeling yourself again. And so I think that's kind of unrealistic sometimes. Or they don't know, maybe, so they just don't tell you. Everybody's different, so but you don't go into this feeling, well, it's gonna be like COVID, it's gonna be a year and nothing's gonna change, and you just have to kind of get through the recovery.
That's an excellent point, Arlene. Yes, because I do think that it's different for every person, but it definitely is not a 3-month turnaround.
Right.
So yes, and if they do give an unrealistic expectation of, oh yeah, you'll be back to work, everything will be fine, you'll just have, you know, to follow up, and then that reality hits, then that just makes the problem even worse. That just makes the feelings even worse. So yeah, going into it, again, that uncertainty, going back to one of the first slides we reviewed, that fear of the you know, unknown of the future and the uncertainty. But yeah, I don't think that anybody can really put a time limit on, because of everybody is, you know, everybody's different.
Yeah, everybody's treatment's different,
Yeah.
length of time, the whole bit. But even so, you just figure, well, it's over, I don't have anything else, I'm done. And then you feel, why am I still just as tired and just having all the problems?
Yes. Yeah.
Well, I have to leave. I'm volunteering at the library in 15 minutes.
Okay.
So thanks a lot.
Well, you're welcome,
program.
Arlene. And this is being recorded, so you can catch up on what you missed.
Oh, good. I'll have to go back in then. Thanks.
Okay.
Bye, Arlene.
Bye.
So what else do we know about depression? As you can see, these statistics, again, these come from the 2020 Cancer Experience Registry. And you can see that, you know, depression impacts the quality of life. And it may lead to decrease in adherence to cancer treatments, and it may lead to longer hospital stays. And so, again, if you have any of those feelings, please definitely talk to your healthcare team, and they can help you with those. But what else do we know about depression? It's treatable. There is a wide range of therapies available. These are just some of the ones, in addition to some of the professional therapy, exercise, physical activity, and the mindfulness interventions have been clinically and research shown to be how beneficial they are And so if you have an opportunity to participate in a mindfulness practice, they are really a wonderful therapy or not therapy process to participate in. I know Kevin was just in this morning doing the mindfulness hour with Cancer Support Community Central Ohio, but there's other mindfulness practices throughout the city that you are able to connect up with. I highly recommend doing so. And then treatment can also be treated with medication. There's lots of medications out there. There's different types, and each type affects it a little differently, kind of like chemos. You know, there's multiple chemo medications. There's multiple antidepressant meds. And so your doctor will really look at which one of the medications will be best for you, looking at your needs, potential side effects, other medications you take. So there's no counter intuitive things going on. They'll look at your medical history, and the your doctor, when you have that appointment, they'll want to know about, again, other medications that you may be on, because we don't want that interference going on. Usually it takes about 2 weeks before the medications starts to kick in, but it can go up to 6 to 8 weeks, because sometimes the medication needs to build within your system and be built up. So it's not, medication's not a quick turnaround. You won't take a pill and immediately feel better, but it will eventually take effect. And about 15% of cancer patients have received prescribed antidepressants, per a study that was done in 2016. So moving on to grief, just take a second and read through this quote here from Mary Oliver. So it is interesting when we have joy and grief, because of it, those are seems to be ends of the spectrum in your feelings. But as we're looking through this, the grief of cancer, one form of grief is the living loss. And this really represents how we may experience chronic or ongoing sorrow. It's kind of that space between what is and what should have been. And this may capture how you thought your life would be, spending your time at this point in your life, compared to, in reality, what you're having to spend your time on dealing with cancer or its after effects. The next one was ambiguous loss. And this type of grief involves a sense of loss that may be unclear, and it defines resolution. We may feel a sense of loss, but not really being able to know exactly what we've lost, which makes it even more complicated to process, that word ambiguous in there. Loss of the assumptive world. We can typically develop a sense of the world and develop assumptions or beliefs that help us to feel in control, and giving us that feeling of security and stability, and really helping us to make sense of our experiences. And this might be that if we have worked hard and had a good life and was a good person, and these beliefs can really form our core beliefs about ourselves and what we expect to happen in our life. But in the face of illness or struggle, these beliefs can be challenged, which can feel disorienting. We may feel stuck trying to make sense of why we are having to go through something so difficult that doesn't fit with how we thought the world would work. And then disenfranchised grief is grief that is invalidated, minimalized, or not publicly acknowledged. We may feel a sense of loss that is not recognized by people around us, such as when people say someone should just be happy to be alive, rather than expressing understanding why someone might be sad that their cancer treatment has pushed them into menopause and prevented them from having more children. This type of invalidation over what is considered an appropriate or inappropriate sense of loss can come from significant others, friends, healthcare professionals, and it may be even internalized when we try to talk ourselves out of feeling grief. Complicated grief, losing a loved one is one of the most distressing and unfortunately common experiences people face. Most people experiencing normal grief and bereavement have a period of sorrow, numbness, and even guilt and anger. Gradually, these feelings ease, and it's possible to accept loss and move forward. For some people, feelings of loss are debilitating and don't improve even after time passes. This is known as complicated grief, sometimes called persistent complex bereavement disorder. In complicated grief, painful emotions are so long-lasting and severe that you have trouble recovering from the loss and resuming your own life. Complicated grief is like being in an ongoing heightened state of mourning that keeps you from healing. And then the last one, the anticipatory grief. If you have a loved one with advanced cancer, you may already be preparing yourself for their end of life. As your loved one's illness progresses, you may be feeling that you've already lost them as a person. If this sounds familiar to you, you may be experiencing anticipatory grief. And I've known somebody who lost their mother to Alzheimer's. And they already had anticipatory grief because they felt that they lost their mother prior to her physical death because of her cognitive decline. And so it's not just the terminal cancer that could bring on this anticipatory grief. So activating hope, hope dies last. And hope is not wishful thinking. Hope is adjusted and adapted over time. So hope is different from just a fantasy, wishful thinking. And so when you're looking at hope, and you're looking at these things that are included in that hope, and that reducing the isolation, because if you remember one of the beginning slides, unwanted isolation was definitely a problem with the depression. And cultivating resilience, we're going to be talking about resilience a little bit more in depth. And so think about, and if you feel comfortable sharing, in the next minute or two, what are you grieving, or how can you honor and acknowledge your grief? And so just think about, there might be areas of your life, there might be things that you've had to let go, and you're grieving over those. And acknowledging your grief, that is very normal, it's very common. And if you're, it might be a new concept to you to honor your grief, but it is an emotion that we need to acknowledge, and that it happens, but it's not a place to live. It's something that you process and move on from. But if you find yourself living in that period of grief for long periods of time, again, please reach out to somebody on your medical team, a licensed mental health professional, to help you process those feelings. And now we're going to move into resiliency. I mentioned that we're going to spend a little bit of time on that. And as you're reading through this quote, there is a number of ways to define resilience. It can range from bouncing back from adversity to positive adaptation or growth during a life disruptions. But most agree that resilience is a process that begins after a significant life difficulty, and it involves ongoing recalibration. So if you remember from the previous slide, resiliency and hope grows, and it adapts, and it changes. So as we're reading through, what exactly is resiliency, a lot of this came from some research in both the psychiatry and in the cancer care. And so you can see here that really isn't something that you have or you don't have. It's something that you build, and it's something that you form, and you can create resiliency. And as you're thinking about, what it all involves, and the ability to restore the emotional and physical functioning when confronted with that stressful life event. And it is an active process. So it's an ongoing thing. And again, it changes and it adapts. It's alive. Let's see if my screen will advance. Here we go. So how do we cultivate resiliency? We mentioned mindfulness practice earlier, and mindfulness can be helpful for a wide range of physical and psychological outcomes, including anxiety, depression, stress, fear of cancer recurrence, fatigue, chronic pain, difficulty sleeping, and immune functioning. And it's also been related to an increase in the perception of social support, optimism, and overall quality of life. And so it's a skill that can be learned, and it really is being present in that moment without judgment, without judging yourself. And we have about 5 minutes left, so we're going to do a very brief experience here. Please find a position in which your body is comfortable. Please close your eyes gently or look down at the floor, whatever you feel you need to feel comfortable. Now take a few easy, slow breaths, and with each, trying to release any tension you notice in your body. Simply begin to notice your breath. Feeling your stomach rise as you breathe in and lower as you breathe out. Notice the rhythm of your breath. It is only natural that your mind may begin to wander. As it does, gently remind yourself to return your focus on your breath. Stay in this moment, gently breathing, connecting with your breath. Allow yourself to feel whatever you are feeling and to be present with your current experience. And when you're ready, you may open your eyes. And that was a very quick exercise. Usually it takes about 10 minutes to go through, but I wanted to be respectful of the hour time. And so as you're doing this, that's what mindfulness is just being present. You can focus on your breathing, you can focus on other things, but breathing usually tends to be a very common part of the mindfulness practice. And so this next slide will show you that there's 3 daily actions that you can take. When it says look for the good, this is not positive thinking. We've already talked about sometimes positive thinking doesn't work, or almost all the time positive thinking doesn't work. Looking for the good is not positive thinking. Allow for both and thinking and feel. This allows for both. Looking for the good allows for both and thinking and feeling. It's about gratitude. So think about 2 or 3 things to be grateful for every night before you go to bed. And this is one way to promote resilience. So as you're ready to end the night and before your bedtime, just think back over the past day and write down 2 or 3 good things that have happened that day. And that just really helps you, one, end the night on a really positive statement, but also that helps build resilience and that promotes that resilience. Take those mindful 10 minutes And then think about acts of kindness that you can, those random acts of kindness that you can show yourself and others. So key takeaways from today's session. Hopefully you've picked up on the fact that distress and depression are treatable and that resilience can be learned. And positive thinking isn't the goal. And acknowledging the fact that grief is real and that it matters. And you're definitely not alone. So everybody is going to be getting a copy of this PowerPoint. And so I'm just going to just briefly show these resources, and you don't have to, I'm not going to spend a lot of time on them because hopefully everybody's familiar with them. But we do have our helpline, which is staffed Monday through Friday, 9 to 9 Eastern Standard Time with licensed mental health professionals. And these are staffed by Cancer Support Community headquarters staff. And then we have My Lifeline, which is that digital platform that you can create community through the family and friends part of it. And then the digital discussion boards, which are 24/7 support groups. We have the Cancer Experience Registry that we had mentioned. There's an Open to Options program that it's a research proven program that helps you prepare a list of questions to share with your doctors. And we can help you create a written list of specific questions about your concerns for your doctor. And frankly speaking about cancer is our education session that created today's topic. And I think everybody knows who we are and who I am. So this, you know how to get a hold of me. So does anybody have any questions here as we're wrapping up? Well, I
was just gonna say, this was a really great program. You did an amazing job of putting this together.
well,
I mean,
thanks,
it
Teresa.
encompassed so many things.
I can't take credit for it. It was created by Cancer Support Community. I just had the wonderful opportunity of presenting it. So but thank you for that feedback.
Yeah, I
Cheryl?
hope there's a Survey Monkey.
Cheryl, I love your birds.
You notice I've been on mute almost the whole time because they're not on mute.
I heard them chirping earlier.
They've been
Darlene,
at it the whole time.
Darlene, I have just a comment on that My Lifeline.
Mhm.